I'm Dr. Sponaugle, and I'm here with Kimberly and Taylor Neighbors, and they have quite a story to tell that involves mold toxicity and Lyme disease and a few other co-infections. And I think the best thing we can do is let Kimberly start telling the story, and Miss Taylor, one of my favorite patients ever, is going to tell her story. So,
okay.
You want to start from the beginning and tell us how things were going?
Okay, well, of course, Taylor is one of the most brightest and precious children I could have ever asked to have. And our nightmare began when she was 5 years old. And at the time, I didn't realize the source of this nightmare, but we now understand full picture of what was happening when she was 5. But she began kindergarten, and in kindergarten she was the leader and teacher's pet and all the fabulous things she could be. But she was not quite happy, and she would have lots of headaches. And so I just thought, of course, she was just missing me all day, so that's why she was having headaches. But first grade started rolling around, and she started complaining of blurry vision and not being able to see the board or her worksheets at school. So I took her to an ophthalmologist, and the ophthalmologist told us that Taylor had perfect vision and her eyes were completely healthy, and there was no need for us to ever worry about her eyesight. So as the mom and teacher and me, I had a really good talking to with Taylor. And I told her there's nothing wrong with her eyes and that she just needed to start enjoying school more, and that, you know, that she would hopefully just get over this eye issue that she felt she was having. So the headaches continued, and second grade starts to roll around, and Taylor had been a really good student and making straight A's and making her parents proud. And no real complaints, except second grade rolls around and they start doing testing on Taylor, and they inform me that Taylor can barely read. And I was devastated because she was an early reader and she had always been kind of the head of her class, and that's when the questions started rolling in my head. And she started complaining again of headaches and not being able to see. So we decided to take her and get her eyes checked again. So here we go again. Taylor's getting her eyes checked, and during this process of us getting her eyes checked, I started thinking back on her medical history. Right about the age of 5, we started having these swollen lymph nodes that came from a tick bite. Now that we know, I pulled a tick off of her, and I started thinking, well, you know, I pulled that tick off of Taylor, and a couple weeks later these swollen lymph nodes start happening.
And the doctor said that one would be
permanent. Yeah, that these lymph nodes were all through her neck, and I started wondering, is there a connection between the lymph nodes and the vision? And I thought because the lymph nodes were every 3 to 6 months, and we were told that they're childhood lymph nodes, which I'm not sure what that means, but childhood lymph nodes, and she would be fine. So when they told me in second grade that she couldn't read very well, but yet she was a straight A student, I started thinking.
And it's important, I think, to interject. I think you did want to brag. You said early reader, but she actually began reading at 3.
Yes.
Age 3, is that
yes,
correct?
early at age 3, and reading lots of books out loud all the time. So I was going, okay, either she was, I mean, and when I'm saying, like, they tested her, they said she was like in the lowest 5% in our nation academically in reading, and I was really confused. So we decided to go back to an ophthalmologist, and they tell me that, well, Taylor's eyes are perfect. They're 20/20. There's nothing wrong with her eyes. And so I went to an optometrist and to get another opinion, and they told me that she had 3 issues with her eyes: convergency issues and like insufficient divergency, and they started recommending eye therapy. Well, her pediatrician said no to eye therapy. That's not going to work. So, but at the time, as her parents, we were willing to do whatever it took to have Taylor's vision normal. So eye therapy sounded good. You know, if it's going to fix it, we'll do it. Okay, so we are sent to Birmingham to a pediatric ophthalmologist, and we are trying to find out why she cannot see. And at this point, when I say she can't see, what this means is Taylor's telling me she's seeing double vision, quadruple vision. She sees a bold word.
I see dots in my vision, white dots, and it's kind of
Squiggly lines through the
squiggly
words.
lines, kind of, and then in the corner of my eyes, I couldn't see very well.
You drew a picture for me
Yes.
of what it looked like.
But it kind of looks like this.
Everything was always jumbled up, and she began to ask me why did I give her books that had misspelled words in them. And I asked her to please explain what she meant by that. And she said, well, like the word "the" is always HTE, or she would see clusters of letters and be able to figure out what those clusters of letters should be spelling. And so I was really confused by that, and I started immediately thinking dyslexia on my own. But we needed to make sure there wasn't a tumor. So off to Birmingham we go, and this pediatric ophthalmologist tells me that her eyes are perfect, that there's no such thing as vision therapy that would work, and she throws a huge packet of research in my lap and tells me I'm wasting my money. So I start crying, and I said, so your child told you that they could not see, and there's nothing coming from the eyeball, that you're telling me her eyeball is healthy. What would you do? And she said, I'd take her to a child psychologist. And I said, okay, that's what we'll do. So she said, in the meantime, buy Taylor reading glasses. She said that it's not going to fix her blurry vision or her double vision or all this jumbled up stuff. But bigger blurry is going to be easier for Taylor to see than smaller blurry. So
We got every reading glasses, like,
every prescription you can imagine.
You told me
from-
you had 4 or 5 different ones you would drag to
Oh,
school.
like between.
yeah, and I would put them in my
because
backpack, and I would just have a little
she had
purse.
like a whole store full of really cute
Yeah, and I would
glasses.
have my a little purse. and
Because
I
your
would-
vision would change
Yes.
by the hour,
Right.
throughout the day. Your vision would change.
Constantly change. So as her mom, I'm sitting here
So-
going, maybe they're right.
Maybe they're
We
right.
do
It's
need to
all
go to a
okay.
psychologist.
I would bring in the ones
Yeah.
that I usually would normally wear. I would bring the highest and the lowest,
Lowest and
and the
then-
middle.
Yeah, because so she was doing it all day, different glasses on and off all day long. And I would just keep buying her the stronger ones and the weaker ones and whatever we could do just to get her
Right.
work done.
Well, this is second grade or
This
first
is
grade?
still second grade.
Second
Yeah, we're in
grade.
second grade, and we went to
So
Birmingham.
it's 3 years ago.
Right, and so they send us to the psychologist, and the psychologist in Atlanta tells us, and she is on the board of dyslexia, so she's really familiar with how to diagnose. She says, your child is brilliant, she's got a very high IQ.
And, I remember the test they did on this for me on dyslexia. I remember they would have little animals on it and words, and
You have to match them up.
yeah, and it was hard. And then at the end of it, they would give me a little toy.
Right, and then and being that she was always so bright and articulate, they tried to tell me that she was definitely dyslexic with a high IQ, but she was also ADHD, which I kind of laughed because I've never seen her act, hyperactive or, I don't know, it was just interesting, the diagnosis. So back to Auburn we go, and with this new diagnosis of dyslexia, and I feel like we found an answer for the blurry vision. We're going to be just perfectly fine the rest of her academic life. We're going to get all of these implements in for her to have help with the dyslexia.
No, but
So-
this time, you'd seen how many eye doctors?
Oh gosh, 1, 2,
She's
3,
by age 7,
4,
so
5.
5
And all
by
of them
age
said
7.
her vision was perfect.
5.
Yeah, except the ophthalmologist who said there's some convergency going on.
Correct.
So.
Which would
but
be
yeah.
upper motor neuron. Okay.
Mhm.
So,
Yeah. So.
all right.
And the lymph nodes, we'd seen the, month after month after month of the ear, nose, and throat specialist looking at all the swollen lymph nodes, just saying childhood lymph nodes.
Mhm.
So,
I think childhood lymph nodes is as ignorant a diagnosis as growing pains. When my daughter started having difficulty at age 13, she went from being able to do more pull-ups and more push-ups than any guy in her class to pretty much bedridden. And I went to some top sports medicine orthopedic surgeons that I'd worked with years ago. And I respected their opinion greatly, And they said, oh, she's having growing pains. And just to make any parent feel better about sitting on a diagnosis, getting a foolish diagnosis because of lack of knowledge, ill-knowledgeable physicians will throw out all kinds of things that I don't even think exist. But I, as a physician, sat on this growing pain thing for at least a year before I did anything, because you believe, you're supposed to believe physicians.
Yes.
But when physicians cannot explain the mechanism, that's when you need to run.
Right.
But we'll come back to mechanisms at the end of all
Right.
this, but I'm
Right.
just, you were trying to do everything you could do, 5 eye doctors, and this was all
Yeah.
within the course of about a year.
Yes, from first grade to about year and a half. And so, and the lymph nodes were, of course, one of the alarming to me, because the first thing you start thinking is lymphoma, or, and why are they reoccurring? You don't just have swollen lymph nodes if there's not inflammation in your body somewhere. And so that's why I started becoming a self-educated doctor.
You have to.
Trying to read everything I could to figure out why she had these lymph nodes. Why does she have blurry vision?
Right.
Is there a connection between the dyslexia
Right.
and the lymph nodes? Okay.
And there really isn't.
Right, and so we have the diagnosis and we're feeling good. So we go on to 3rd grade, and
But she's still making straight A's? or
Yeah,
she's-
she did great.
In spite of the
Straight
fact she has
A's, yes.
difficulty reading,
right.
difficulty seeing the paper.
Right, they said that she was learning everything auditory. So anything that she had learned up to this point in her life, they felt like it was all auditory.
That's how you do it.
Yeah.
With that high
So,
IQ.
yes, and they, yeah, and when, well, then in 3rd grade, right, we find out that my husband is going to get a transfer. So we start thinking about the psychological effect of kids having to leave their home. And I start noticing a lot of behavior changes in Taylor, who had been this perfect or close to perfect student, child, whatever. I start noticing a lot of behaviors as I'm waking her up in the morning. She's sensitive to light, which she had always been, even from, like, I have pictures of her as an infant, where and even one, she can never go outside, lights were
and I
always an
remember
issue.
this one beach trip, I was about 7, I couldn't open my eyes and I would cry because I couldn't see. I
Yeah.
couldn't open my eyes or
That was all during the process of figuring out what was
Sure.
going on.
You've seen a lot of light sensitive patients in my clinic.
Yes.
And a lot of them are young females, age 15, age 20, and so she was mold toxic from
Yeah.
probably age 2 or 3.
Yes.
Was she jaundice at birth?
No.
Because that's one of the patterns I see.
Yeah.
If the mother's mold toxic
Yeah.
during pregnancy, the child will have, quote, idiopathic, means we don't know what's causing it, but jaundice, but it's actually
Yeah.
the trichothecene or trichothecene, whichever, either causing the liver failure in the child. But so you weren't too toxic at birth.
Right.
She was reading by 3.
Yeah.
Everything's fine, really, from
Yeah.
about the 5th grade.
Yeah.
Or
Well,
from
3rd grade.
5
yeah.
years of age.
Yeah. And then the 3rd grade, when I start waking her up for school, I notice that she doesn't want any kind of light coming in her room, and she starts telling me, "Don't put those clothes on me. I don't want them touching my skin." And I'm telling her, "Stop being so ornery. We're got to go to school.
Sure.
You cannot go in your pajamas." And so then the strict
the
mom comes
sheets
out.
would bother me.
Yeah, and the sheets, she didn't want them touching her, and she started telling me every morning, and it wasn't just a telling me, it was more of like, "You don't understand. You don't know what's going on with me." And she would say, "I'm sick and I need help." And I said, "You're not sick. You don't need help." And I would bring a thermometer in there
Sure.
and shove it in her mouth and say, "See, you're going to school today."
Yeah, before the clothes were so bad, did you notice the tags? Typically what kids
Oh,
are
I
wearing.
had to.
We cut those things out for
That
years.
comes
Oh,
years
yes.
before. See, this is all about excessive electrical current running through the brain and body. And the first thing is always the tags. Oh my God, cut the tags out.
Yeah, we didn't even have tags by the 3rd grade.
I know.
No, we didn't.
That's what I wanted to bring out.
Yeah.
For some of you mothers out there, if your child is developing severe neurotoxicity, severe brain toxicity, when the electricity reaches a certain critical point, excessive electrical voltage in the brain and body, the first thing you're going to notice with the kids is they have to cut every tag out. Some of you mothers have to cut your tags out too, because you're neurotoxic and don't know it. But the kids will want all the tags cut out. But when you reach the point, the tags will need to be cut out about the same level of toxicity that you have the light sensitivity, you have some anxiety, and when you get a bit more brain toxic, just a touch more, then you can't tolerate the clothes, and you feel like your brain, was going to explode. How did you feel with your brain? Just like
it just felt like it was gonna explode. Like there was so much, there was pressure, but it was just.
And that's what she would say, and it would take me. I'd have to wake her up almost 2 hours before we'd have to leave because I knew the process. I knew I'd have to talk
this
her
is her
into
combating you,
Yes.
being somewhat rebellious.
But yeah, and I thought it was because we were going to move. And
Exactly.
I'm like, yeah. Okay.
People always assume these psychological things
Yeah.
when they don't know the deeper science, and you continue to go to physicians who don't know. Some of the science that I've developed here with the excess glutamate GABA shift on the toxicity, it's going on all over the country, but you always assume the child's rebelling because
Yeah.
they want to, and you assume that there's another reason, whether it's your father moving to a different job for a little bit, or changing school years, or changing school. We assume all kinds of things, and that's what psychologists and psychiatrists will do very quickly. So you always have to be careful. You were starting to play the doctor role, which most of the mothers in this clinic have had to do, and you have to use common sense to differentiate, like you did with the lymph nodes. Well, that doesn't quite match this, and there are a lot of things going on. Mold toxicity, German science has proven years ago, and I see it in thousands now, that the mold toxins alone will cause lymph node swelling. Of course, Bartonella is notorious for that as well. But
in the middle of the school year, I had to move, so I had to go to a different class and everything, and that is when it kind of.
Well, you're nervous about meeting new kids, right?
Yeah,
And that will increase the electrical voltage in the brain above normal, the anxiety. But see, if your baseline electrical voltage in the brain is normal, then there's a little bit extra voltage, you have this much anxiety. But if your baseline electrical voltage is already up here, and then you add the anxiety to it, it's a really scary thing.
I had a lot of anxiety about everything. I would worry about everything.
Right.
Things I wouldn't even need to worry about.
Right.
Things that weren't going to happen, but I still worried about them. And I couldn't stop myself. I wish
Well,
I
and
could
her
stop
reasoning
it.
skills went completely down. And when the reasoning, and this is right when we were supposed to move, when her reasoning skills went down, I really started getting worried because I knew I had a highly intelligent child, and to try to reason with her was I couldn't do it anymore.
Sure.
And so I felt like we have an issue. What are we going to do?
Well,
but I thought it was behavioral.
Right.
And
Well,
so,
and I taught you guys in those workshops and in the rooms I teach you that the most sensitive brain region to the toxicity, the mold toxins and some of the other infections, is this frontal lobe. That's your reasoning center, your executive center, your judgment center is right in here, your impulse control. And so the more toxic your frontal lobe gets, the less reasoning.
right.
But also the absolutely first region to shut down is this 4-second processing learning memory. What's amazing is she was getting so brain toxic, so neurotoxic that she couldn't tolerate even clothes. And you want to yell and scream at people for no good reason, and you can't help it.
Yes,
But
that
what's
is
amazing
true.
is, and what validates that she has an excessively high IQ, I mean a genius IQ, is that because this 4-second learning, processing memory right in the temples shuts down first, you're still making straight A's, even though you were severely toxic. That just validates that your IQ is extremely high. An average IQ would already be suffering. And I've had many kids come here, and when the house developed a problem with a water leak in the wall or something, you see, classic story, you'll see a mother gain 30 pounds of weight in 6 months. If there's a problem with a leak in the roof or something, mold running, but the kids will go from A's to C's. You somehow managed to do it.
Yeah, and I mean, when we moved to Tallahassee, the grade started.
Well, and that's because we had started treatment. We'll get
Yeah,
into that.
it
But
was-
yeah, it started to fall off, and when her academics started to decline,
That's when
I
you
knew
knew
it
there was
didn't make
something deeper
sense.
going on.
And
Right.
then at my worst,
So-
I had to take this humongous test, and I got an F.
It's
That
okay. Yeah, it's
And that's
okay.
not, and
That's not
her.
good.
That's not our girl.
No, that is not good.
No, so we're still in Auburn.
Yeah,
second
we're still in
grade.
Auburn, and
And
so
we've now ascertained through.
Yeah, this is third. We went into third grade, and the
Okay.
temper tantrums. Her dad had kind of moved before us, and I started videoing her temper tantrums because I couldn't believe it.
No,
I was
I
like,
get
this
angry.
kid.
And you sent it to your mother and
Yeah,
everybody else
yeah,
who
and I
knew
was like,
she's
you
this,
gotta watch this.
this
And I-
sweet child
yeah,
is suddenly You think her head's going to spin
well,
around,
possessed
right?
or something, and I'm like, what is this? And I was like, look at her. I was like, she's never acted like this
Right.
before. It's crazy. And they're like, oh, it's because you're moving. I'm like, okay, we'll see what happens when you move.
But
So-
I would get angry at you because
Yeah.
I wouldn't want you to video it.
Oh yeah, but I had to. I had to have evidence because.
But
I
your
mean,
brother
come on.
had fun with that, didn't he?
Oh yes, he loved watching it.
You love watching me, like,
Yeah, act like that. But so, we end up moving, but we have to stay in a hotel for about a week. Well, and I'm now understanding that this hotel probably had lots of mold. Not knowing it at the time, but I forgot the important point. We had to get a physical before we moved. And the doctor walked in and said, her vision is now 2100 in a year's time, and you need to take her to a retina specialist. And I said, oh, she's got dyslexia. I said, we're not taking her to a retina specialist. I said, I've been to every eye doctor. There's nothing wrong. She has no tumors. She's dyslexic. He said, no. You need to go to the retina specialist just to be sure. I said, well, we'll go when we move. So we move, we stay in this hotel.
This is from Auburn to Tallahassee?
Yep, we're going to
Okay.
Tallahassee, and we stay in a hotel.
This is summer, between second and third year?
Actually, it's January. We moved
Okay.
right after Christmas, and
Okay.
it's in January. So we're in the middle of the school year.
Okay. Third grade or second grade?
Third grade.
Third grade, okay.
And she's,
and we were at the pool one day.
yeah, the pool at the hotel, which was covered. There's no airflow.
Covered with mold.
Yeah, I mean, just, yeah, and no
It's
airflow.
unbelievable. isn't
And
it?
So I couldn't
Taylor's
get in the pool,
sitting at the pool.
and it was freezing, so I couldn't get in it. So I was walking around the pool, and I said, Mom, are you not seeing this? And I actually
Yeah.
saw this exact picture in the water.
Colors
And it
and-
was colors, and it was horrible.
Bubbles, and
And
she
it
said
was-
she felt like she was tingling all over her body.
And I couldn't walk
And I
very
thought,
well,
oh.
and I was having to walk slow.
And I was like, here we go. Here we go again. I was like, do I need to videotape
So
this?
now you're
I mean,
thinking
I'm-
she's
I'm-
actually, maybe she is psychologically challenged.
Yeah, I'm starting to think, okay, yeah, now we're going to have to get
So
counseling.
now you and
we're
Jackson
moving.
are in the pool,
Yeah.
your brother, and she won't come in.
No,
She sees all this
sees
weird stuff.
colors and she's starting to tingle, and I'm thinking, this.
Now, she
But
started
my
tingling
body
all
temperature,
over.
it was like I
Yes.
couldn't get in because I was freezing.
And so luckily, we're going to go to that retina specialist within like 5
Right.
days of moving down there.
Let me stop you for one moment,
So-
because she had what we call cytoneurotoxicity, but it's just the excess electrical voltage in her brain and body. You'll start out with some anxiety, insomnia, then it develops into more panic, and it develops into a bipolar-ish thing. And I told you, and tell all you folks, I've reversed over probably 3,200 kids being 20s, 30s, 15s, who were diagnosed bipolar, and it's actually the shift in the brain chemistry that I've determined through all these science that I've done. But anyway, what's fascinating is she had all the excess electrical voltage, didn't want to be touched. And for you mothers out there, it's called hyperesthesia. They don't like, if you touch the kid, leave them like this, it feels like a razor blade.
I remember when anybody touched me, I would scream and say, "Don't."
And one
touch
thing that
me."
you mothers need to understand as well is that you want to hug your kids, and they don't want to be hugged. Their electromagnetic field is really like buzzing, and they need more space. And the sicker they get, the more the mother wants to hug them. And so you need to understand it's not a personal thing. They seriously cannot stand people touching them. And it goes from an irritation to where it actually hurts. But what's fascinating is...
And I would just want to float, and because the couch, my bed, the sheets, my
You
clothes.
just want to float in the air because nothing should
Yes.
touch you.
Yeah, I
So you want to be
know.
an astronaut
Yes.
without the spacesuit,
Yes.
right?
Yes. Yes.
But here's what's profound. You walk into this closed-in pool deal where it's not like hidden mold, where most of my patients, it's hidden mold behind walls, above the ceiling tile, various things, always behind the shower tile. That's the mold's hidden behind the wall. It's not actually visible in a lot of places. But the gases that change the brain chemistry, and I've proven this in over 12,000 people, it changes the brain chemistry such that the glutamate surges can no longer convert to GABA, so you get this electrical charge. But when you walk into this closed room, it's a gas chamber where you see visible mold. The gas level is so high, and she breathes those gases in. They immediately go from the lungs to the bloodstream, and they shut down. Actually, I brought this, I think, just to show folks once. Maybe I didn't. I did. Here we go. I teach. My research going back to 2007 has proven that the trichothecene or trichothecene, the gas from black molds, shuts down the enzyme called glutamic acid decarboxylase. And that enzyme converts glutamate to GABA. So the way God set this system up, you eat the glutamine is supposed to constantly convert to glutamate, which is a stronger electrical neurotransmitter really than adrenaline. It's the first step in the pain pathway, actually, is the glutamate surge. And that should constantly convert to GABA, the primary calming chemical. So when this glutamic acid decarboxylase enzyme is shut down from massive levels of trichothecene and the industrial toxins, the uric acids, and some of these other toxins that I've proven with my own clinical research, then the glutamate surges, the GABA drops, and the patient becomes severely over-electrified, and to the point of bipolar and even schizoid. And you got some more stories to tell about that. But what's fascinating here is you're already, if normal electricity in your brain and body is at this level, you're already up to here. Light sensitivity, probably had buzzing in your ears already, maybe not yet, but that will be coming. But when you walk into a gas chamber where the gas content is so heavy, and this is why we need a meter. We walk in a room, push a button, and it measures these gases. It hits you so hard, so fast, your electricity went sky high, that you started seeing things, having hallucinations. Okay.
And I remember I would feel like the gravity, it would like come down on me.
You feel like you're in this dark hole when your brain's severely toxic. You feel disconnected from people you love. You don't want to, but you feel like you're watching the world go by, like you're not in it.
I know, that's how I felt. I felt disconnected from the world. I felt like I wasn't there.
Exactly.
In the conversation. And
when I was severely mold toxic in 2006, I felt like I was watching myself go out to dinner or watching myself at work, and I began to wonder, am I schizophrenic? The brain is electrical. And what I teach in that workshop is when you have a certain excessive level of electricity, you reach a point where you overthink. And that's really what paranoia is. This is where the hallucinations come from. The profound thing is, though, you walk into a gas chamber, and it hits you that quickly. Before she walked in the pool room, where the visible mold was everywhere, you didn't see all the weird stuff in the water. And you were probably getting more agitated, more irritated, the more you stayed there. And I want to drive this point home, folks. I've measured over 6,000 mold toxin levels, more than anybody in the world, and I've correlated these to 12,000 brain chemistry patterns and 500 other numbers in the body, and no one has done this research. But you start out with insomnia, then edgy anxiety and insomnia. That moves up to panic disorder, which moves up to bipolar-ish behavior. And then beyond that, even schizoid, paranoid. And again, I've reversed over 3,000, probably 3,500, 3,200, I don't know, bipolar-ish patients, diagnosed bipolar by university psychiatrists. And it's actually this massive level of toxins in the brain and the shift in the brain chemistry. And you can reverse this very clearly. There are so many parts of the body that are being hit. And all the patients I've treated with this, the parents, the wife, the husband, the entire extended family, believes that their niece, their nephew, the husband, the wife is crazy. And psychiatrists will attempt to tell you it's a genetic deal. Well, if it's genetic, why weren't they bipolar at age 5 or age 10 or age 15? Why is the average age of onset of bipolar age 30? Because it takes most folks who become bipolar-ish, the non-genetic bipolar disorder, it takes 3 decades of toxin accumulation. But what we're seeing from my patients from Canada, Australia, throughout America, is that these younger kids are getting more and more mold toxic at younger ages, and the behavioral changes are coming sooner and sooner. And you look around a clinic here with 15-year-olds with MS already, and 20-year-olds all in my clinic that are in wheelchairs and have MS, which we reverse in these folks over time. And that's where she would have been heading. It's interesting that she developed the vision problems before she developed more of the neurological problems with the weakness, but she had some of that too. But I just want to drive home how profound it is. You walk into the wrong building, the wrong restaurant, And
And I could like sense if there was mold there because I wouldn't feel good.
Yeah,
Well,
she
really
started
nauseous.
feeling like she couldn't
well,
walk
the headaches,
right
frequent
after
headaches,
that.
frequently, the headaches come as well from this excessive electrical voltage. It puts a huge squeeze on the vessels, and you get the pounding headaches in the temples because the electricity is so high, it squeezes the blood vessels down, and you get reduced blood flow. Then you get lactic acidosis built up in the microcirculation, and it makes the vessels then dilate and rebound and pound. Did you have headaches right up in here, sweetie?
Yes.
And all these things, it's just, you've met a lot of people in this clinic, and I'd say 70% of the patients here were told by someone, from NYU to Stanford to Harvard to Mayo Clinic, that whatever, Mecca, Emory, wherever they live, that this is all in the head. I think you've met a lot of females, probably 80% of the females in my clinic have been told that it's all in their head. They convince the husbands, they convince the family, and they convince the parents. And so, you know, your mother hung in there, like the mothers I have here, and said, my child's not crazy. You keep looking for answers when you get none, but I just wanted to drive that home, that you were just dying, and there's nothing, unless you understand this deeper biochemical science, doctors are clueless as to what's going on because there's nothing to see.
Yeah.
And that was the problem you're having.
Right.
So, okay,
Yeah.
so this is now January, I guess.
Yes, and we're headed.
Third grade.
Yeah.
You're moving to Tallahassee now.
And we're going to the retina specialist.
When she didn't want to get in the pool because she saw this weird stuff in the pool.
Yes, I immediately thought, oh God.
Then you thought, okay, she is crazy. You called
I was like, oh
you
Jesus.
called your sweet mother, who I've met and love dearly.
And I just said, please
I
don't
know
tell
you did.
anybody
What did your mother? You called your mother, didn't
Yeah,
you?
well, yeah.
Most likely?
I kind of kept that a secret, and I just
That's
figured.
what I want to find out.
Yeah.
And that's for the mothers out there.
Yeah, I didn't want anyone to know.
It's such an embarrassing thing if you believe that your child is psychologically impaired. You and your mother are extremely close, and yet you didn't tell her.
No.
And that's
no,
profound
no.
because it's the most embarrassing thing. And you said something profound earlier. You said that when you really got to the point where she thought she was schizophrenic, which
Yes.
I'm going to let you lead back up to
Yeah.
that again, you'd rather had some
horrible,
incurable kind of a disease. We have a stigma against mental illness, and we all will deny, with our greatest power, deny that our children are bipolar or schizophrenic. And I will tell you that my clinical research, I've treated thousands, has proven that 99.9% of the bipolar schizophrenia in this country is related in some way or sense to mold toxicity, which shuts down the immune system, and then to brain infections. It's always a combination of brain infections with Lyme, Bartonella, Proteoxoid rheumatica, and toxoplasmosis, in addition to excessive toxins. And it's all about the inflammation in the brain, but even more so the brain electricity. And I've reversed bipolar in a lot of these folks in 2 or 3 weeks. And just so you mothers know, because mothers out there all over the country are dealing with kids. They're dealing with Adam Lanzas. And, you know, I wrote a blog article Christmas Eve, a couple months after the Adam Lanza deal, explaining what the kid really had. And when they get to be that age, you weren't going to walk into a school and with guns and shoot the place up because you were too young. But there's a lot of people out there with good hearts who just want to shoot somebody for no good reason even. And it's all about this excitonneurotoxicity. At your age, you don't walk in and shoot somebody, but you felt like choking something, didn't you?
I felt like choking somebody.
Oh yeah, we can get into that.
No good reason. Oh, you got that on video.
Yeah, we got lots of video.
And you don't know why, do you?
No, and it was so confusing. I would just cry, and I would, like, I don't know why.
You see, when people are driving, they feel like just ramming a car for no good reason. And a lot of road rage, the trigger's already cocked when the
Yeah.
brain's not electrified. All you need is someone to pull out in front of you.
Yeah.
And
I would have to be very particular with the way I asked her questions or the way that I.
Or I would get offended.
Yeah, so I trained myself on how to
Sure.
talk to Taylor, and I knew that if I did not ask her in the right way, that there could be a price to pay for that. So.
We show you that oval shape, that walnut-sized deep limbic system, that when it's severely over-electrified, you become easily offended. And you have to dance around these people.
I just
And
tried to figure out the best way to communicate with her.
how many mothers in America do you think are dancing around this right now with children from moldy schools and so forth?
Yeah.
But anyway, go back to this deal. So you
yeah.
pulled her out. Did you guys leave the room? Leave the pool
No,
house
because
or
I
what?
didn't. I got aggravated because first of all, I thought, here this child's telling me there's some bubble colors all over the pool, and she just doesn't want to be in here. And I felt like because of her intelligence, she's manipulating me because she doesn't want to be in
Jackson,
the pool.
her
And
younger
we're
brother,
having
he
fun.
wasn't having fun.
We're having fun. So I thought, here we go again.
See,
we're gonna have
that's
to.
important because these mothers are the same thing.
Yeah.
Your younger brother, who doesn't have these things going on, he wants to be in the pool. You're having fun.
Yeah.
You even thought,
And he
I
wanted me to
guarantee
be
you.
in the pool, and he would say, Taylor, come on, come
Yeah.
on.
Did
throw
you
me
think she
this
was actually
toy."
jealous even because you're having fun with
Well,
Jackson?
yeah. Well, what I
These
always
things are
thought
through your mind.
is, yes, everything that was going through my mind is she need the attention back on
Exactly.
her
That's what I
because
would
we're
just say.
trying to
Yeah.
have a good time
Yeah.
here, but we're not. It's not what she wants to do.
Right.
So I thought it was a controlling issue or that manipulation or, she's going to just do what she has to do to get her way.
Exactly. That's
And
what I want you
so-
to bring out because
Yes.
and I really appreciate you being so candid.
Yes.
Of course, now you're back to being the perfect girl with perfect eyesight, and we'll get to that later. So we can talk about these things now. You don't mind, do you?
Not now.
But I think it's so important because those thoughts go through your mind.
Yeah.
You know other mothers are having the same thoughts.
Yes.
And so,
And I began to think that the good counselor was going to be really good for us.
okay.
So
All right.
we had,
So,
But
Yeah.
we were going to the retina.
yeah, so we,
well, before so you stayed at the pool for a while because you're like, she's manipulating.
Yeah.
I'm going to have fun with my son.
yeah.
So did she get more angry or what did she
Well,
do?
what she did was just kept sitting there and looking at bubbles, and I'm like, this is really freaking me out. So yeah, so she kept, and then she did demand. Finally got to a point where
Okay.
we could not stay because she was demanding us to leave that pool.
And all the
So-
time, if you're in their house, every
like
minute,
10 minutes.
every few minutes,
my
your electricity's up. You're
frustration- Mm-hmm.
feeling more ragey inside, and you know you're sick, but there's nothing for people to see.
No, and I'm getting
I know,
frustrated
no one
because
be-
here we
I
are.
felt like no one believed that.
And I didn't believe
Sure.
because we had dyslexia.
Right.
And dyslexia doesn't make you act like this.
By
That's
the
what I
way,
thought, yeah.
I began proving in 2000 that the toxin shut down the frontal lobe will cause dyslexia.
Mm-hmm.
I teach you guys the focus center is right above the right eye. I know you got all this because I've heard you talking in the IV room and explaining the science to older folks. They can't get it like you do as a 10-year-old. But that focus center is above the right eye. It's a dopamine D1 receptor. And my research has proven that these toxins, particularly these mold toxins, block the dopamine receptor. So when that focus center is shut down, it's also the braking region for your brain. You will jump from the beginning of the sentence to back into the sentence. And you get this diagnosis of dyslexia that can be reversed fairly easily by pumping these toxins out of the brain, which isn't easy, but
Yeah.
you know what to do. And so I would suggest she doesn't have dyslexia now.
We haven't
she's
seen
been
signs
here.
of it, especially since we were starting to do schoolwork again.
Yeah, and
hasn't
she doesn't
been-
have it now as she's
She's
10
not
years.
reversing words.
So we also reversed her dyslexia.
Yes.
But I'll let you move on. It's just a
Yes.
fascinating story.
Yeah.
I'm fascinated actually.
Yeah. So we head over to Panama City to this retina specialist who informs me very bluntly that Taylor has 2400 vision in her right eye and 2350 in her left. And at this point, she's wearing sunglasses pretty much 24 hours a day. She wears them watching TV. She wears
Sure.
them, and I'm thinking, what is going on? So she tells me Taylor has something called rod cone dystrophy, and that she would probably eventually go completely blind.
And I remember in Atlanta, right
And
before we came
so-
down here, I would have to put a blanket over my head and just like put sunglasses on and just try to block the TV as much as I could.
Right, and so what happened with this diagnosis from this retina specialist, she wanted us to go to Emory University to find out what they could possibly do to help Taylor or to slow it down or just to reinforce what she thought she had found. So we head up to Emory University and we run through a gamut of tests, MRIs, any test known to man to find out
Brain
what's going
MRIs,
on. Everything.
everything.
I mean, anything that the ophthalmology community could offer anyone that's losing their eyesight, we had those resources. And the best vision that he could get on Taylor at the time was 2100. So her vision had fluctuated. And he looked at me and said, vision doesn't just fluctuate.
Now think about it. By the time you went to Emory,
It had
you've
been,
been out of the Auburn house for
right,
how
about
many
a month,
about a
maybe
month.
a month or two.
So
yeah.
even though genetically she removes those toxins supposedly 468% less efficiently, but getting out of the Auburn house and away from the swimming pool in the hotel,
Yes.
you already came back somewhat from 2,400 to
Yeah.
2,100. I'm actually surprised you did reverse that much, but.
And it was like 2350.
So
Well, wait, that was
did the
before
folks at Emory, the ophthalmology folks at Emory, did they say it was a retinal deal as well?
What they said is that her eye, the actual eyeball, was completely healthy. They said, we don't know why she's having vision problems. And they said, we can't find anything wrong. We don't know, so we're going to just call it unknown.
Unknown. Idiopathic.
And they said, just why don't you give her some attention? And they said, I guarantee you in 2 weeks, her vision will be back to perfect.
If you give her attention.
Yes.
This is Emory University.
Yes, give her attention, but her vision's 2,100 and we don't ever need to see you again.
Okay.
And I said, okay, so it's 2,100. She's almost legally
So
blind.
did they think she's actually faking the
Yes.
exam?
Yes, and so, they did the eye reflector things, to get
Sure,
that,
sure,
everything. And they did the Goldman's field and test on her, and she had pockets of where she
You had
couldn't
an
see.
ophthalmologist, a retinal specialist in Panama City that said the retina had been affected.
Right, rod cone dystrophy.
And that was a couple of weeks before we went to
Yeah.
Emory, and they said there was nothing wrong with the retinas.
Right.
Okay. That doesn't
So
add up.
right, so I start getting more confused, and I start getting scared because 2,100 vision is not good vision for someone when the glasses can't correct it. And the reading glasses at this point were doing nothing.
It's
Uncorrectable, nothing. They said uncorrectable.
See, that's profound because, see, if it were classic lens, the shape of the lens, the reading glasses should correct 2,100 and bring it back to 20/20. But it did not.
No.
Which proves that this diopter change, which is usually the lens, the shape of the lens was not the entire problem, so it proves it was a deeper problem, neurological problem in the vision area of the brain, etc., which we'll talk about what we did here to correct all this. But
Right.
that's just something I wanted to point out. There are a lot of people out there who are 2,100, but they put the glasses on the right
Right.
refraction and they're corrected.
Right. Hers
So
was uncorrectable.
Yeah.
So they send me home with Taylor, who has 2,100 vision, and expect me to send her to school and for her to read and be able to see worksheets. And they blow these worksheets up this big,
Oh,
which
seriously?
embarrassing her. It's
They would do it
embarrassing
for
to
her.
her.
They did do it for her, though.
Yeah, but it was embarrassing.
So
I
she has these
mean,
big
she had
sheets.
lights. They had lights.
I'm
they
not
had
laughing
special
at you, I'm
things.
laughing with you.
But
'cause
yeah, it was traumatic.
We can laugh now, but it wasn't
Yeah.
too much fun
Yeah.
then, was it?
But I
New
mean, they
school.
would have this big. They brought
Magnifying
in these two
glasses.
ladies.
Seriously?
They brought in these
Oh, yeah.
Might mean huge.
No,
might-
huge
oh,
magnifying
okay.
glasses, lights. I mean, everywhere.
They brought
Like
in
trying to
these-
put light on
And
her
where was this? This
paper.
was in Tallahassee.
Yes.
Well, you have to admire the school system for
Yeah.
doing it.
Well, absolutely. I mean, they had.
But it didn't stop the embarrassment, did it?
Right. No.
Yeah, but they brought in these two ladies, and they gave me all this stuff, and I would have this thing. It would bring it up to my face, like, and then it would have a big light
Yeah.
that came down on it, and it was a magnifying glass in front of it. They would put like
Yeah.
this thing, and then
Oh,
I would
geez.
read in this room while we were waiting in the car line, and I would get made fun of so much. And
Oh, it's terrible.
The kids were
I
making
would
fun of
just
you?
read
Oh,
my
yeah.
book.
man.
I would just read my book and
Third grade, Mean Kids.
I know.
The Mean Girls. Remember
So-
the movie, The Mean Girls?
yes.
They starts in third grade,
Oh,
right?
yes. It was terrible. And
So what'd you do at home? Did you have this apparatus
Well, so
at home,
then
or
no,
what?
so then she would carry almost like a suitcase of this eye stuff from school to home every day. It was like dragging just for her to see. And I kept thinking to myself,
was
is
so
this
heavy.
our fate? You know, are we going to have to do this for the rest of her life? Carry all of these things around. Is she even going to want to continue school with the frustration of not even being able to see? So we were crossing this bridge of her vision, and then Taylor starts, and I was not satisfied with just unknown vision loss. Okay, so I'm going to continue to dig. And we start having some buzzing in her ears that turns into screeching. The loudest screeching, she said, that you can imagine, and it's 24 hours a day. And when she starts having these episodes of screeching, she's losing more of her vision. So her vision would just go black to where she couldn't see, and she'd get on the floor because she was scared, because she couldn't hear and she couldn't see. So I call a Lyme literate doctor because I've been reading so much, and every symptom that you could imagine that she had, she was starting to have. Her hair was falling out. She was her skin was mottling. The lymph nodes were everywhere. She couldn't see. She couldn't hear. She likes. I mean, any nightmare of a symptom. She started cramping. She couldn't walk. I couldn't touch her. I couldn't wash her hair, so she would walk around with greasy hair because I couldn't wash it. couldn't touch her hair,
Sure.
couldn't touch her
When
skin.
I did wash it, we would have to put it in the sink.
Yeah, and very delicately just drizzle water over her hair. Her fingernails hurt. And I would just drag her on a blanket through the house, little bit at a time, because any type of sensation.
You would actually put a blanket under
Her
chest or her carrot?
yeah, because I'd have her roll over onto a blanket, and then I'd just pull her through the house, or I'd put her on her brother's skateboard.
And I would just
kind of push her through the
just have
house.
my night clothes on.
Just
and I would
a barely light T-shirt on, because anything at that point was
I'm sure
hurting her.
I'm sure cover and heavier blankets
Nothing.
bothered you too.
Her bed, she wanted to sleep on the hard floor, because she said any kind of
So I
anything
slept
that
on a
formed
blow-up
to her.
mattress.
It cradles her back.
Yes.
So I slept on a blow-up mattress.
Yeah, and it was a nightmare. So we get to this Lyme doctor, who we were thankful for. She intervened in a time in my life
Right.
when I felt like we either have a child who is a pathological liar, who really doesn't have vision problems and has manipulated me, her teachers, everyone, or we have a really sick child. And I begin to think sick because of the hair falling out, the physical symptoms on her. So I didn't.
That I can't really make happen.
Right, there were things, you can't make your lymph nodes swell, just by thinking it. So she does diagnose Taylor with Lyme's disease, and we begin a treatment of herbals and 25 different antibiotics. I mean, just
25?
lots and lots. Yeah, we're rotating them every 2 weeks.
So I assume she got sicker every week.
Doxycycline.
Right.
And what starts to happen, Taylor starts getting sicker. And as her mom, I'm saying, she doesn't have Lyme. If she had Lyme, we're giving her an antibiotic, she's going to get better. So when I say sicker, what I mean is,
I would start getting
well, what would happen is I'd heard of restless leg syndrome. Well, Taylor started having restless body syndrome. And this means
She was actually starting to have pre-seizure stuff.
Yes, the seizures. And what happened is she would start about 6 o'clock every night. She'd start rocking and twitching. And then about 8 or 9.
Her twitching was one side or both sides?
Or all over her body, both sides, all over her body. Just she couldn't stop moving. So she would start running up and down our street for 2 hours. And we would walk with her and watch her run up and down the street at all hours of the night. When we put her in her bed, she'd start running in the bed.
I don't remember running or anything. I just remember falling.
Yeah, but she doesn't remember a lot of what happened during those months.
But I don't remember running up and down the streets. I just remember falling with things coming at me.
Yes, she
and
was hallucinating. So
red.
as we were getting this treatment, this is when I decided to pull her off all medication. She had started having myoclonic jerks for an hour at a time, 4 times a day, and she was hallucinating. Things were coming at her face, and she was screaming and very paranoid and fearful. And at this point, I finally decided it's not Lyme, because we'd been treating this for months. This is psychological. My child has schizophrenia, especially when she started the paranoia and the not knowing who I was and asking for her mom. And
So she actually didn't know who you were?
No. And she would say, my real mom, if you were my real mom, you would make all this stuff. You're not my mom. Where's my mom? And she'd scream for me, her mom, to come get her. And she'd run away from me. And people in our neighborhood, because we were in a new neighborhood, didn't really understand what was going on, because I would be chasing her in the car. And so we had to tell all of our neighbors that she was really sick and we didn't know what she had. But it looked like I was always kidnapping her. And so I would grab her in a blanket.
They assumed you're beating her.
No, in a
abusing her,
blanket.
sure.
I had to wrap her in a blanket and squirt Risperdal down her throat to try to calm her down, because I was asking the doctors for just injections to inject her to knock her out. They're like, what do you want? I said, I want something that I can inject in her and knock her out.
No, this is the spring of 2014.
Yeah. And so they kept saying, what do you mean? I said, no, I want her to be knocked out. I want her unconscious. You don't understand. She needs to be in a hospital because there's something so wrong with her. I can't control her. So Jackson and me would hold her down and squirt medication down her throat.
And I would ask for belts around my legs and
because
my
she
body.
said she wanted us to take belts and wrap her really, really tight, as tight as we
wouldn't have all
could,
the jerking.
and she wouldn't jerk. And if she did jerk, she was in one spot. And so I was scared someone was going to knock on the door and see my child on the floor you know, doing this weird stuff, and me and Jackson laying on her, trying to comfort her.
I remember one day you just told me to get on your back that we were going to the hospital.
Yeah, and so I would put her on my back because I couldn't carry her, I couldn't touch her, you know, lift her. Certain positions I couldn't lift her in. So we went to this hospital because she's jerking and twitching. I drive to the emergency room. And the one doctor that was finally honest, it was a pediatric, and he walked in and I said, I don't want to hear you diagnose her. I said, because at this point we knew we were coming to you.
Oh, you did?
Yes, this is kind of getting late into the fall. I started pulling her off medications. I said, she has Lyme's disease, because I then started reversing my kid's Lyme. You know, it was back and forth, all the time. And I said, I just need you. He goes, well, first of all, you know more about Lyme than I do. And I said, what do you mean? He said, I don't know anything about Lyme. He said, most doctors don't know anything about Lyme. He said, so tell me what drugs you want. And I said, I don't want drugs. I said, what we need is something to make her stop jerking. And I said, we'll handle getting her treated for Lyme with someone who knows what they're doing. I said, so just get her body to stop jerking, and then we'll, you know, go from there. So that's when it got bad, and we pulled off all the medications, and because I thought medications were making some of this happen, because it was just intensifying.
And when you pulled me off the medications, I could walk.
Yeah, she could start walking.
So she'd actually gotten to the point where she couldn't walk.
No, she wasn't walking. I carried her for about a year.
So she would have been in a wheelchair. Did you have a wheelchair for her?
Oh, she wouldn't do it.
Oh,
so she wanted Mama to pick her up, this 9-year-old, and so I would carry her through the store, and people would look at me like, what are you doing?
But psychologically, you felt that was better than being in a wheelchair.
Yeah. She felt like it, I think at the time, what she explained to me was if she felt like if she got into a wheelchair that she would never get back out.
Well, it's very embarrassing. I don't know if you watched the testimony I did with Mia from Australia and her mother, and she was talking about, it was at age 13, she was in a wheelchair, and she was talking about how her mother would be pushing her down the mall, and she'd see her friends, and she said, quick, turn around. And her mother said, I had to race down the hallway, get way to the other side of the mall. It's a very embarrassing thing, but was it more of the embarrassment of the wheelchair, or was it really you thought you might be stuck in the wheelchair?
I thought I'd be stuck in the wheelchair. I thought I would never, I wanted to walk.
Because we have to look at this from a 9-year-old's perspective. And you know, so
and trying to walk, it was needles going through the bottom of her feet, and so she would roll her feet out to try to walk on the, you know, sides of them, and then. No
burning pain yet in the feet?
No, just needles.
Okay.
It was always needles just shooting straight through.
Now I would get this really hot heat, like it would only be on one part of my body.
And that would move around, or was it?
It would go from
her face, I know,
my
was really.
head, my feet. Sometimes
her
they
knees.
would burn.
Typically, well, that's what I'm talking about. The
like
just for the folks out there, you know, what I do is some really sophisticated neurological work, which Kim will testify to, as well as a lot of other folks. But my typical patient has been through 10, 15 Lyme doctors. I have one 28-year-old girl who's been through 25 Lyme doctors by age 28. The problem you have a really compassionate, intelligent Lyme doctor, the one you saw in Gainesville. She's actually referred me some patients, but did she refer you to me, by the way?
Well,
in
we
the end,
told
did she say it was over her head, and she refer you? Or?
Yeah, because Taylor, I kept telling her it's not getting well or getting worse, and I said I want to go see Dr. Sponaugle. And when I mentioned your name, she said, I think that's a great idea. She said, I've sent several patients there who have great results, and she said, I don't think I can do anything else for her.
You know, she's can handle, like she's like the rest of the Lyme doctors and eyelads. They can handle more simple Lyme, but they can't handle the deeper brain neurological things. You have to, this protocol designed, as you know, a neurological protocol, it's intravenous. It's very aggressive, but you have to be careful how you do it and so forth. But a couple of things I want to mention is that as the electricity goes up, you start to have the myoclonic jerks. But also, as the myelin sheath on the nerves becomes saturated with these toxins, toxins from Lyme and Bartonella, etc., but they're not nearly as strong, they're not nearly as neurologically potent and deleterious, neurologically speaking, as the mold toxins and some of the industrial toxins. And what was happening, though, is as you went on herbals from Dr. K, that would bust biofilm some. There were a lot of these other toxins coming out. And most of the patients here have never had the industrial toxicity diagnosed by the Lyme doctors or the mold toxicity. And those toxins are very, very neurotoxic. And when they initially hit the myelin sheath, it's the insulation of the nerves, there will be a pins and needle effect. The pins and needle effect also comes from the excess electrical voltage. So as the electrical voltage keeps climbing throughout the brain and body, there's a pins and needle effect. Then you move from that to the burning pain, and that's what I was asking about. This is for folks out there. And it's amazing, you know, Kamea was only 10 years old when she went in the wheelchair, and you're 10 now. But that burning pain, it usually starts in you females in the bottom of the feet, in the lower legs. I have a few females out of thousands that they get in the face first. But it's about I've said for years, I may be wrong, but we've proven it by getting rid of it sometimes in 2 or 3 weeks of treatment. It's the infiltration of these fatty toxins, lipophilic toxins, like liposuction is fat, lipophilic toxins. They will not stay in the bloodstream long. They will migrate to and deposit in the fattiest area of the body, which is the myelin sheath, on brain nerves and peripheral nerves. And I've been saying since 2008 these are causing MS, multiple sclerosis, and that has now been proven by Japanese brain scientists. It's not been proven in America. In fact, if you look up multiple sclerosis on Emory or Mayo Clinic or Harvard, I'm just picking on these universities because they're big names, they'll tell you we don't know what causes MS. I do, and I've reversed it in quite a few people. But that's where she was headed.
Well, and
the
that's what the
myoclonic
neurologist
jerk.
said.
Oh, you had a neurologist that actually
Yeah,
said
right
that?
before we came here,
And what did he
we
say?
took her and he did muscle biopsies, he did MRIs, and he looked at us and he said, this was, I mean, we've seen 22 doctors, 12 different diagnoses, and he said to us, it looks like and acts like Parkinson's and MS. He said, it's not that, but I'm going to give her drugs to treat her symptoms. And he wrote out a ton of prescriptions and said, give her those.
And what I had to do when you got here, besides pushing those toxins out of your retinas, and the retina is a very fatty nerve, and I was just explaining this to one of my friends who's a retinal surgeon. The retina is a very fatty nerve, and so all these fatty toxins are going to move into the retina and displace good fats like omega-3, 6, 9, and CLAs, and all these good fats that are supposed to be inside the retina. It's just a film, but it's very fatty. So I was able to ascertain, really by 2009, in fact, in a very moldy hospital office, I had 2 retinal detachments in 1 year. And I knew it was from the black mold that we found hidden in a wall. There was no proof, except my own deduction in 2009, but by 2011, German scientists had proven that the trichothecene black mold toxin will destroy the retinas if you have enough of it going on. We had various toxins affecting your eyes, but we had the industrial toxins and the trichothecene at high levels. Certain maneuvers I do will push these toxins out of the nerves, out of the retina, out of the brain, and then you see the very massive levels. I have people test at the exact time. It's done with precision, so we see what's coming out of the nerves and the brain and even the retinas. And there's a lot of people here. Everybody here had the blurry vision at first. It just never got quite as profound as yours. But that's the mechanism by which people lose their eyesight. And I'm convincing my friend, Dr. Dupree, who we had you see recently, to do a study with me and improve the much higher prevalence of retinal issues, macular degeneration, the rod cone deal. All that was due to toxicity. I wouldn't have been able to reverse it in 3 weeks. But anyway, I wanted to explain that part to folks because there's so many people out here who are having, I'm sure, studies would suggest premature retinal issues and premature vision loss. I'm sure it's way more profound and way more prevalent now than it was 30 years ago. So they need to know those things. But I want you to go back to her vision was getting worse by the day, and we're now, you said 3rd grade.
Yeah.
The big microscope deal, the whole magnifying glass, but it got worse.
Right.
She was actually essentially went blind.
Yes, and that's when they were saying it was probably the rod cone. And so for mother to have a child, when I would hate to speak for everyone, but for my own personal, I would think losing your eyesight after having eyesight would be one of the hardest senses to lose. So after being told that, my life began to just spin out of control because I had a child who was looking at me saying, well, I can't see. I need you to turn on lamps at night, and I need flashlights. I need you to hold flashlights on the side of my eyes while I sleep because I'm scared I'm going to wake up and I'm not going to be able to see. So I was sleeping with her, and lamps were on her eyes, and I was laying there with flashlights so she would go to sleep, shining them on her eyes.
And I would have to have a lamp somewhere, or a little night light, so that if I woke up, and
she
it was
would know she
completely dark,
wasn't
I would know
blind.
I
Oh
was.
my gosh.
And so I slept with her I had her sleep on my chest at the age of 9, and I would just pray over her, and I would ask her, she'd ask lots of questions that I didn't have answers for. But I explained to Taylor that, God knew her fate and when she was formed in my womb, and that if this was his path for her and for me, that this is what we would walk with. But I told her we need to be thankful that she could still see out of the sides of her eyes.
And that's all she could see out both sides.
Yeah, sides. She could see, out the sides of her eyes. And I said, maybe God will preserve that for you.
And this was last summer.
Yeah.
This was like July,
yes,
August
like a
of
year
14.
ago,
Okay.
less than a year, a little over a year. And so I kept telling her to look for the positive. At least you can see something out of the side of your eye, because she's like, well, I want to see your face.
Well,
I want to see it clear.
I can't see I couldn't see right here and right here.
You could see the middle.
I could see, not the middle, kind of the
No,
diagonals.
you were carrying her
Mm-hmm.
everywhere she went.
Everywhere we went.
She's having the panic attacks and even the schizoid, the paranoia,
Yeah.
delusions.
Attacking me in the car. I mean, we sit here and we talk so calmly about, oh, Taylor was having this symptom. Sweet Taylor was having that symptom. It wasn't, oh, sweet Taylor. It was, oh my God, could somebody kill her or me? Because one of us has to have some relief.
Yeah.
I'm not
No,
kidding.
seriously.
I was in such a panic of distress that I felt like she was going to die, or I was going to die, or her life was over. The life that I knew up to this point
You
was
mentioned
over.
that at
and
one
mine
point
was.
you laid down on a carpet
Yes, my face
Face
in the
down.
carpet,
and just
and
cried your eyes
I
out.
did, and I let the tears just hit the carpet because I didn't want to wipe them away. I thought I don't care if I flood the room. I hate my life. I hate her life, and I hate that we got to a point where everything that I dreamed of for her was over. And I thought, how could she have this brilliant brain and be so smart, and it's just going to go to waste? And so I laid in the floor and I asked God to just let me die, because I didn't know I'd be able to be strong enough for her. And so that's what I did. And she didn't know. And when I saw her, I would just tell her that it was going to be okay, that this was our path. And so, but that, you get to your worst points in life for God to pull you up and show you that you can do it. So what I focused on was just breathing through those moments when she was attacking me physically, because I would be there by myself with her. And I just kept telling God that I wasn't strong enough. I'm not strong enough, just go ahead and let me die. Let somebody that's stronger just come in and take care of her, please. And so...
Now, she wasn't still going to school then, though, right? Couldn't
no,
go to
she
school
might
like
go
that.
for 30 minutes, and then I'd pick her up.
Then you go back and
then,
get her because...
And then I'd lock myself in a closet, and she would beat on the door and scream at me because she didn't know where she was,
I
and
would
she
just
couldn't
have to
see,
watch
and she
you.
couldn't
So
hear.
you really couldn't see the
No.
chair, the desk?
No,
or-
she...
I couldn't see anything clear. And I remember just watching TV, like movies all day, because that's was
And-
all I could do.
yeah.
I couldn't...
But were you actually seeing the movies, or were you just listening to the sound?
I was basically listening to the
And-
buzzing, and I had to have some sort of...
It was
The buzzing
screeching.
She had to
ears.
download an app on our iPad that would hum to me.
Yeah.
It was like a...
She needed noise, so we were trying to find hearing aids that would just
Oh.
make
You
noise
you
in her
needed noise
ears.
And
to
I would
overcome
listen
the
to
buzzing, the
noise.
tinnitus.
And I would listen to rain sounds and
Yeah.
anything.
So, but yeah, so it's easy to calmly talk about and collectively describe to you so you can have a clear picture of symptoms, but it literally felt like hell would be better than what I was having to consciously live.
Sure.
That's what it felt like for
Now
me.
Jackson would go to school.
Yes, and then he would come home and try to help me.
Try to help you. So
And he was in the second grade.
So he became, in the second grade, a physical and emotional caretaker for
Yes.
you
And he would
her.
run in the afternoons. He would see her her hands would cramp and then her feet would cramp, and he would run and get one of our neighbors to come and help me hold her down.
When she would just be flopping?
Yeah,
Pull
or
those-
attacking me. It depends on what the day was.
Yeah.
She might attack me, or she might go into some jerking or screaming and ripping the house up and coming after me. So
A lot of times when that electricity is so high, the electrical voltage in the brain, and remember folks, the brain is an electrical organ. Besides the delusions and hallucinations and the rage and the panic, there's this feeling of, as we said earlier, total disconnect, and this is what allows the Adam Lanzas and all over the country, these folks to go into a workplace and shoot folks and not feel anything, and almost be to the point of just numbed out, yet their brain is so over-electrified. I was able to ascertain probably in 2007 or so that the cause of that ringing in the ears, this is a Sponaugle-ism, as I like to say about things I figure out that may not be right, but they tend to prove that they are. In fact, the first one we reversed, I didn't know how we did it, but it was a man from New York that I treated, and that was actually 2006. But if the brain is so over-electrified, then all electrical impulses are amplified, whether it's from touching you here, or mommy trying to hold you, but there are little hair fibers in the middle ear, and that's where we pick up our sounds, and they're moving constantly. So my theory years ago, and still today, is that when you're so over-electrified that you amplify that voltage coming in, and you actually hear the little bzzz, the bee buzzing, but when it gets to screeching, you've reached the stratosphere on electrical voltage. And what I can't tell you, with all confidence, is why some people have more seizures than others, although I have proven, or my folks, my patients have proven, if you have trauma in the temporal lobes, particularly, you have a scar, then you're more likely to get a reentry circuit in seizures. But the myoclonic jerking can be the excess electrical voltage, but at the same time, the caudate nucleus in the brain is shut down, and you get more of the Parkinsonian movement. But once people start with myoclonic jerking from the underactive caudate nucleus, these toxins are blocking dopamine from brain receptors. That has not been proven anywhere else yet, but it will be by German scientists who have proven that these toxins block thyroid from the receptor. And the thyroid hormone comes out of what amino acid? I'm just picking on you, because you always know these things. Well, the tyrosine becomes thyroid or dopamine, and so the molecules look almost identical. But at any rate, you get the toxin blockade in the motor regions, and you get the Parkinsonian thing, starts to restless legs. But when you, at the same time, have this excess voltage, so you have some underactivity in certain brain regions that are motor regions, and then yet you have the excess electricity, so what would be just restless legs becomes a wild, kicking restless leg. I'm assuming that's what she was doing.
Yes.
And even the monoclonic jerks, so the monoclonic jerks are both sides, start just like this stuff. Yeah, it's like a pre-seizure thing, I'll tell people. It's all about the electricity. And unfortunately, when these patients do have seizure-like activity, there are probably, out of 75 people in my clinic, you've talked to these folks, there's probably 50, 40 minimum patients who've gone to an emergency room, been seen by a neurologist, who has never heard of excital neurotoxicity. I mean, you can Google it in 5 minutes. No one's done the extent of research I have, measured all the different changes in brain chemistry and the surges of noradrenaline and adrenaline and phenylethylamine and other electrine brain chemical, but it's out there. But they will tell everybody it's psychological and psychogenic seizures. It's such nonsense, and they let you seize all night. Did you ever take her to the ER when she had the seizure-like
Yes,
stuff?
that's when the doctor looked at me and said, well, what drugs do you want? Because you know more about Lyme than I do.
Okay. And see, it wasn't really the Lyme. Well, it can be. If it's one-sided, The Lyme will pick one side of the brain normally, and you'll see one side, but hers were typically both sides,
Yeah,
right?
and I mean, it started with the cramping in the feet, and then it was just all over. I mean, it was all over. You couldn't stop it. Her heart rate was out the roof. And I was always worried of her having a heart attack.
Well, yeah.
We went several times because of chest pain.
You know, I talk about that shift in glutamate GABA that I've determined here in thousands of patients. Glutamate activates a receptor called NMDA, which opens the calcium channel up. And I used to do a lot of cardiac work, what I still do because I have so many people here with cardiac issues. You know, Lyme affects the heart, so does Bartonella, but the heart runs much more on the calcium channel, which is open through the glutamate NMDA receptors. So when glutamate surges in these situations because of the toxicity, the heart gets way more what we call irritable, cardiac irritability, and that's why you see so many patients in my clinic, young kids, 10, 15, 20, having cardiac arrhythmias all the time, and it's not just the sinus arrhythmias, but heart's very sensitive to calcium. Plus everybody from all the Lyme doctors, antibiotics develop severe candida overgrowth, which causes magnesium deficiency. I've written chapters about that for naturopaths for their books, and magnesium blocks the calcium channel, so the perfect storm for Lymies, if you will, that's what you folks call yourself, is you get a lot of antibiotics from Lyme doctors which cause your magnesium to be on the low end, so there's less magnesium to block the calcium channel, and yet the glutamate surging, causing more calcium influx in the cardiac muscle. So, you know, 15, 20-year-olds having cardiac arrhythmias, it sounds stupid. But I've actually had 17-year-old girls who are having not just atrial, but ventricular beats that could lead to V-tach. So everything that quote, Lymies have, and it's just Lyme is in vogue, but as I tell you guys in the first workshop, 80% of your Lyme is not your biggest factor. It's a factor, but Lyme is in vogue. At least it's in vogue. They don't think everything's mono like they used to. So, but in your case, you had it all. In the symptoms, I mean, she just had the full gamut of all these things that I see, and it's just amazing that.
I'm not sure if there's one symptom she never had.
You know, I talk about so many symptoms in those 5-hour workshops I do, and good Lord, I think you had most of them. But to be out there and alone, like you were, I mean, no help from physicians, and so if she's going, I mean, as your brain got more toxic, the glutamate was surging higher, and then when you got the treatment from the Lyme doctor, a very compassionate, passionate Lyme doctor, what they can't do, any of them, they don't know how to detox, they don't know how to do the brain piece. And the brain is controlling everything. And that's what I love. I used to love the heart. But I moved to the brain in 2000, and I just love the brain stuff. But when that brain is so out of balance, then everything else is out of balance. And but by the time she was the retinas were taking that much of a hit, and the lenses from that one toxin that's a metabolite, oxalic acid. I taught you about one of those metabolites that's sky high in autistic kids, but it actually can help the lens and cause cataracts. And that would change the lens. Her initial exams didn't show a problem with the lens though. 4 or 5 or 20, how many ophthalmologists she had. But the one in Panama City, I think it was, the retinal specialist said there was retinal issues. A month later, supposedly weren't, but there still were when she got here. So I mean, she had every symptom I can pretty much think of that I see in my patients, and you had no answers or mechanisms. You know me, I don't like symptom treatment, I like mechanisms. So you had decided, I guess, by this time last year, somewhere in there, you were going to come to see us. But she's getting worse and worse. The ringing in the ears becomes screeching. The sporadic paranoid delusions became more daily consistent. The vision's getting worse. She's not walking anymore.
I'm dragging her.
And what was happening, when she started developing the burning pain in the feet, it usually hits the bottom of the feet first. It was intermittent. It becomes continuous. It comes with the legs. And that's when the myelin sheath is becoming so inflamed from these toxins. And even before you get the scarring, which is seen on MRIs, the white spots, bright spots, there is a halfway point between healthy myelin that I've determined in which the inflammation is in the myelin. You see increased T2 flare on MRIs. The radiologists don't know what it is, but they'll call that. And once that myelin is inflamed, the electromagnetic field around that nerve changes and electricity slows down, and hence the weakness.
Yeah.
And it goes from weakness to paralysis eventually, but so you really got her here just in time to prevent the full-blown MS thing from occurring. Sounds crazy for 10-year-olds, but if you remember Kamea, for you folks who haven't seen Kamea's video, she went in a wheelchair at age 10, and what's dramatic is she went from 4 hours a day of gymnastic training to a wheelchair, and her mother was told, her mom was initially told, it was stress by Canadian doctors, and then New York doctors weren't much better, but similar deal, very similar, but hit her more physically. You had it all, and you, I mean,
I felt someone hijacked my child and put somebody else in her spot. I didn't even know her.
Well, okay, so it was last summer, I think. You're laying on the floor, you're crying. You're like, please, God, just take me out of this deal.
Yeah.
You're really praying for both of us to go to heaven. You know?
Yeah, let's just go.
Let's just go. Bring us on home.
Yeah,
we don't want to,
I
we
did.
Don't
I
want to
prayed it. I'm like, I'm so ready.
I know you believe in
Yes.
heaven. I know you're a strong
Yes.
Christian, and I know that you would seriously say, I think we've all done that at times. Most of us probably didn't have as much of a reason to as you did. I mean, seriously, we're such weenies, aren't we? We're such Christian weenies. But you know what? You really truthfully would say, Lord, please just bring me on home. Why would you want us to go through this?
Yeah.
Because you don't see any light at the end of the tunnel. No hope. And you're scared to death.
There were no answers.
There's no answers. That's my point.
And the answer that we had wasn't getting her any better, it was making her worse.
Now, by this time, last summer, July, whatever, you're laying on the floor, you're crying. You really can't take it anymore.
No.
Your husband's working out of town, so you're...
No, we were in the same city to Tallahassee.
Oh, okay, you were, okay.
Yeah.
Did you, and she's not making it to school.
No.
You certainly weren't trying to homeschool her, were you?
Well, we had to enroll her in it, but there was no real
I mean, I can't imagine a lot going on.
No, we had some medical, our doctor wrote a medical.
Okay, so she's scared to death, you're scared to death. Little Jackson, her younger brother's scared to death.
Yes.
And you just kept going.
Yeah, every day.
And by this time, you were convinced she was probably schizophrenic?
Oh yeah, I remember the day I decided to come to terms with that.
The very day.
Yes.
I think that's profound.
I remember the day because she was in the bathroom and she dropped down to her knees and she had an episode where the ringing in the ears started. And when the ringing in the ears started, she'd lose her vision. And she started crawling through the hall at me. And she was like screaming, I can't see. And it'll sound bad, but I got mad. I was like, you can see and you can hear, so stop doing that and stand up. And she wouldn't stand up, and so I started crying and I ran away from her. I ran out in the front yard where she couldn't find me. And she pushed our glass door open and she was on all fours screaming, Mommy, help me, Mommy, help me. And I mean, this had been months and every single day, day in, day out, at night, not sleeping because she's running up and down the street at night, so I'm not sleeping, she's not sleeping. And I'm standing in the front yard with my cell phone looking at her at the front door like this, screaming for me to help her, and I'm standing in the yard saying, I can't help you. There's something wrong with you, and it's not Lyme, it's nothing. She's got schizophrenia. Right. So I picked the phone up, and I called my mom, and I said, I've been denying this for months. I said, we've gone to every doctor. Emory University said she's fine. The psychologists here say she's fine. Put her on Risperdal. The Lyme doctor said, oh, it's Lyme. Well, guess what? She's getting worse. And I said, this child is schizophrenic. Where do I take her? And I said, she's going to have to be in a hospital until they figure out what's wrong with her. I want to know the truth. And I said, I want to know if it's schizophrenia, bipolar, or some horrible disease we just haven't diagnosed. I said that I told my mom, I said, I wished it was just something, a cancer, something else. I mean, it's terrible, but I just wanted it to be something besides schizophrenia, and that's what I was convinced that it was. And so she's screaming at me, crawling through the yard trying to find me, and I'm telling her to stop, and it wouldn't stop. And so, but I was ready to come to that day to just finally have an answer for relief for both of us. And I felt like if we know it's schizophrenia, then they'll at least put her on medication.
You wanted a diagnosis.
I just wanted something. I mean, I didn't care at that point what it was.
You're being so candid. And I think it's wonderful, because I can tell you right now, the mothers that find this video, there are thousands, tens of thousands out there going through the same thing. And again, it's so profound. We said it earlier that you really, it's the last thing any of us want to believe. And you know what? But you're at the point now where even if you get a real diagnosis, at least you got a diagnosis.
Yeah.
I don't think any of us can really feel the hopelessness you felt.
No.
But, you know.
Well, and anger, and that's a true feeling of anger.
Well, you had to be angry at God.
Well,
Weren't you angry at everybody? I mean,
well,
most of us get angry at...
well, to put it, it wasn't anger towards God, because it was anger towards something, and I wasn't sure what it was towards. Because I know that God had the plan. I knew He had a plan. I didn't know what it was. But it was never anger at Him. It was more anger at something. And I was trying to direct the anger at Taylor, because I felt like we didn't have a diagnosis, and you're so bright. I'm being honest. The anger was towards her. It was like, why are you making, I was like, did she read, Google how to mess your parents up? I mean, what did she read? I mean, did she read all the symptoms? Did she learn how to like act like someone with MS? Did she learn how to act like someone with schizophrenia? What has she been looking at on the computer? I was doing history checks. I was just trying to figure out, what has she read? And so because her symptoms were ever changing from day to day, you were going, okay, you could see yesterday, so don't give me that crap. I mean, I literally was telling her.
But toward the end, she wasn't moving from.
No.
Toward the end, it was consistently down. But other symptoms come and go.
But yeah, no, then it just came very blatant that she was not. It was not something that she was.
Yeah, she starts busting some biofilm, and my research has proven there's loads of toxins in there. One day they're more toxic than the next. They can be more toxic 3 hours later if their immune system is chipping away at biofilm and toxins pop out. But so that would change some. But so now we're up to the summer of 14. You guys came here and...
Well, we were supposed to come in October, but they found what they thought was a cyst on her left basal ganglia. And so I called down here and I said so we had to go. We had to postpone.
Was that Emory or who?
It was the neurologist who said he thought she had MS or Parkinson's, and he wasn't real sure. And so we had to postpone coming. And we did a lot of testing to see. And I was praying it was a cyst.
Right.
I was like, oh, yes, Lord.
Yeah.
This is a cyst.
Something we can
and
cut
we
out,
can just
potentially.
move on.
Yes.
Let it be a cyst. And it wasn't. They found it, and then they had to rerun everything, and then it wasn't there.
That's right. We talked about that the first day you guys came.
And then by that point, I'd weaned her off all herbals, all antibiotics, everything, and a lot of her symptoms had stopped.
Sure.
And so I was like, oh, she's well. But so then we got to you, and praise God, we're here.
So you came here, and we had quite a consult the first day, because it's quite a history. And I guess she doesn't remember anything about that. She was pretty much out of it. Was she even in the consult?
Yeah, she was. She was
there.
sitting.
She sat there. Your mother was there, as I recall.
What consult? It's been a long
The first day I met you guys.
Yeah.
But, I did have her do a PET scan, but I was pretty sure, based on the history, that we were doing more with severe toxicity in the retinas. But Bartonella loves the retinas as well. So anyway, we actually, I think we thought it was about 3 weeks of treatment. We had her vision back to pretty much normal.
And that's my main concern as her mom was, okay, we can deal with these attitude and mood things, but we can't lose her eyesight. I mean, that was very devastating. So
the biggest decision for me always is it more important to aggressively kill with these intravenous, mostly all natural treatment I do, add some antibiotics, to prevent vision loss, and that's what we talked about the first day, or is it more important for me to remove toxins? And problematic with the Lyme treatment in America, patients are given herbals and or pharmaceutical antibiotics that do produce some killing, but killing without adequate detox is a disaster. And it just saturates the brain with toxins and the rest of the body. And quite frankly, 5 years ago, I did not know how to do what I do now either. Actually, 2 years ago, even I keep advancing my treatment. But It would have taken me, good Lord, I don't know, 6 months to get our vision back, probably 2 years ago, but I think it was 3 or 4 weeks, wasn't it, that we had restored our vision completely?
Yes.
And I think we got rid of most of the ringing in the ears and all that
Yep.
excess
All
electricity,
that
probably
stuff.
about a week. Because that was my first priority, was to bring that voltage down. And we were all so excited. And we have a report from Dr. Dupree from last week.
Yes,
He's a retinal specialist, and he said that
it's perfect.
2020,
Yep,
2020 vision.
2020, perfect.
When you came to my doorstep, it was the 2400,
100,
2100.
2100.
2100. So she'd gotten some of the vision back. So the ringing in the ears
Yeah,
and all those things. So,
and we did that.
yeah.
Yeah,
And so,
and she's reading and doing her schoolwork. and
no more
wanting to
dyslexia. No
do-
more dyslexia.
No, she's wanting to do her math.
See, proving, and this is the thing, there's so many myths in medicine that drives me nuts. Once I ascertain things are not something you inherit, again, it's genetics versus epigenetics. And what's happening in America, folks, is the epigenetics, the effect of the environment on genes and on the bodies and brain, it's way more profound than the genetics often. And so if the dyslexia thing is said to be more of a genetic thing, you were told that, I'm sure. Well, if it's genetic, I couldn't get rid of it.
Right.
So it was actually just a toxed out frontal lobe, and that's something for a lot of you folks to know. Your kids are in school, and this neurological protocol design is very aggressive. It has to be done in a setting. I train in intensive care medicine. We run our IV unit somewhat like a mini ICU. We have intensive care type nursing, and you could vouch that we see a lot of people there. You can't do this unless you know how to treat. You never know how much of a toxin load is going to hit the bloodstream at one time, and it can be very dangerous if you don't know what you're doing and you don't have the ability to quickly remove those toxins. And so, but moving the toxins out was the beginning of it. Then we did look at some specialized blood smears, and we decided we had some Bartonella that should kill. And in fact, one day you so cutely broke out in a big Bartonella rash.
Yeah. It
That was
was,
miserable.
When
I know, it was on my legs, it was on my face, it was
Yeah.
on my arms, it was horrible and itchy.
And when you did that, we weren't inducing a kill. The Bartonella, the Lyme, Ehrlichia, all these bacteria are trapped in biofilm, and if you're not careful, you will pop the balloon and pop too many infectious microorganisms out at once. And the last thing you want is to have a lot of Bartonella come out at once and hit the retina, a retina that's already been damaged and still, if you will, raw with a bunch of Bartonella or Lyme. So you actually broke out in a Bartonella rash just without me inducing a kill. Because you have to know, it takes judgment, you have to know when to hold them, when to fold them, and if I were just to induce a big kill, induce a big biofilm bust, which I can do very easily with some specialized drips I do, intravenous drips I do, I can bust biofilm in 3 days more than people do in 3 or 4 years at other practices. We have these patients here all the time, they have huge biofilm bubbles on their blood smears, and that's after 5 and 10 years of Lyme treatment. But if you bust these organisms out too fast in the wrong person, it's a mistake. But when we make the brain work, when I detoxify the brain runs the immune system. That's what neuroimmunologists are clearly stating. The immune system is the tail end of the neurological system. But this computer, 3-pound computer, runs the neurological system and subsequently the immune system. So once I get the brain detoxified, the immune system in almost every patient here goes into, their kill power moves more toward what God intended, usually within a week or two of being here, and so then they have what we call spontaneous kills and spontaneous biofilm bust. Her original blood smears didn't show any Bartonella, but then you bust. I walk in one day, you're sitting there with your grandmother, and you say, "Oh, look at this rash! It was a classic Bartonella rash." And so at that point, I knew we had to move fast. I knew she had busted Bartonella out of biofilm the night before, and we have to move fast because we don't want that Bartonella to circulate in the bloodstream and get to the retina and or to the brain. So we adjust things here on a daily basis. There's no McDonald's protocol. It's you have to change your intravenous therapy every day based on what happens. How long did it take for that Bartonella rash to disappear once we got
A few weeks.
couple weeks? It was huge. She had the rash.
Everywhere.
And it was getting worse, and then
On
it
her
would
face.
finally get better.
Yes, and I was so afraid it might
It
cause.
kept on getting worse and worse and worse, and then it finally
Yeah,
got better.
you had. I mean, most folks here will have a Bartonella rash cover certain sections of their body. You had it over your entire body.
Yeah.
So there's no doubt that she had a lot of Bartonella infection. That probably was from the 5-year-old bite.
Yes.
What happened along the way is you got more toxic, and your brain shut down more, your immune system shut down, and so whereas your army was holding Bartonella and Lyme and various organisms, the mosquito parasite Protozoa rheumatica, holding them at bay, these toxins, you move into a toxic situation, the house at Auburn, various schools, and suddenly the kill power goes to nothing, so some of these toxins shut the CD4, CD8 ratio down more than HIV. And so then all of a sudden the bugs win. So anyway, we're just about ready to have you go home. So every symptom you had, what do you still have a few things, we're still doing some kills right now. We're doing some parasite kill for some of those protozoa. That hurts a little bit. Not too bad.
I actually do really good on all of it.
She really does. I mean, she's the most amazing patient. I don't think that any of my staff, nor I, will ever let you go home.
No.
We'll just pay you to walk around and make everybody smile, because you do it so well.